our community does not know the face of affordable housing. They don't know that it's the postal worker and the teacher and other people, the clerks and the secretaries that work in our city and county offices. They don't know that that's the face of affordable housing. And when I go to public meetings, I still hear the public saying, if we build affordable housing in this area, the gangs, the drugs, it's going to, this is just going to pollute our neighborhood. I mean, nothing could be more ludicrous, but that's where we're starting in our communities, is with that perception.
Here in South San Francisco is part of San Francisco County's 2012 Affordable Housing Week. We welcome our residents here tonight, as well as those of you from other cities across our county. Examples of affordable housing developments along Centennial Way and El Camino Real to support outdoor activities are Coleman Creek or Chestnut Creek, affordable housing for seniors, and Mid-Thames Family Housing 109-unit affordable housing development, which will be opening this fall. So you here are residents, you can help the city plan for future growth of our community by participating in events such as this.
Before ST speaks, I just wanted to talk a little bit about why this is so important. Housing, which is very important to our group, is also very important to every other group. In the sense that the health of a community really cannot even begin without having a stable place to live. Whether it's education, whether it's jobs, transportation, these all have an intersection with housing. And in this county, despite the mighty efforts of individual cities in trying to produce affordable housing, there's still a very long way to go. I was just doing a talk earlier today where I looked at a survey of the affordable housing across the Bay Area, and the average is about 4.5% for the Bay Area. San Mateo County comes at the bottom at 2.8% of our housing in the county is deed restricted, considered strictly affordable housing. Another number, as a consequence, 60% of the people who work in this county live outside of the county. So that has a number of implications. One being congested roads. It's also long commute times, which decrease quality of life, which impact health. But then it's also just from an economic standpoint. You're also, I'm living in Alameda County, and I come across the bridge to work, I go home, and on the weekends I'm spending my money out there. So there's an economic impact as well. We have the least affordable county in the entire country. So that doesn't bode well for our long-term sustainability. If we continue to see that commute number increase over time, and it has increased over time. Average rents run about $2,000 a month. That's a 17% increase from the year prior. I don't know too many people who get 17% raises every year, particularly in this climate. So these are numbers that have a consequence, and one of the impacts is health. So having a healthy housing environment here in this county will ultimately reflect itself on other aspects of the community as well.
So when I was preparing for this presentation, I thought, well, where to start when we talk about health and housing? And so I kind of went back to, why I was interested in joining the Board of Housing and Leisure Council. Why did I think somebody whose public responsibility is to think about the health of our communities, why would I also be interested in serving on a housing organization? So before I get started, I wanted to just briefly ask all of you to raise your hand and just tell me, when you think of health and housing, real quick, a couple words, what first comes to mind for you?
Walking.
Walking, all right, here, walking. Great, I'm going to talk about that, so perfect.
Senior housing?
Senior housing, absolutely. I'll touch on that briefly, but I also brought a brief that talks more about that, and I'm happy to talk more in detail during the Q&A on that one.
Public transportation.
Public transportation, excellent. I'm going to talk about that one. Great.
Affordability for both.
Affordability, absolutely. And I should say this presentation is really about health and affordable housing. There's lots of issues that are global to health and housing, any sort of housing, but this is Affordable Housing Week, so let's honor affordable housing here, right? Okay, one more.
The absence of stress when you don't have to be in the commute line, when you don't have to be commuting to your job, between jobs and house.
Commuter stress. How many people have sat on the 101 at 5:30, like I do most nights, trying to get home to have dinner with my family, really stressed out. And I don't get home in the best mood. Strangely, I get home in kind of a bad mood, right? There are many people who unfortunately have to go through that every day. So they have 70 minutes more a week. That's not that much, but actually from a health perspective, it really is enough to make a big difference. And it's not just about walking or biking around, but it's also about the kinds of transportation that are available to people. So if you live in a transit-rich neighborhood, you also are more likely to have a pretty significant increase in the amount that you walk per day. Anyone want to guess why? Why, when we talk about active transportation, do we talk about walking and biking, skateboarding or rollerblading, but also transit, public transit? I hear someone here.
Oh, I just said you have to get to the bus.
Exactly, it's as simple as that. It's not complicated. You got to get to the bus, right? Most buses don't pick you up right at your doorstep and drop you off right where you're going. You got to take a little walk. But all that little walking adds up, and it's enough to make a difference in your health. So it's just as simple as that. Don't be shy to ask. Your likelihood of getting a particular disease is very, very related to your income. And this may not be surprising to many of you in the room, but it may be surprising to others of you. And what I can tell you really for San Mateo County, where you live is one of the best indicators of how long you're going to live and your health. And so here, Kathleen, please.
One quick, I think I heard a clarifying question of what does FPL stand for?
Oh, I'm sorry. Yes, the jargon. Thank you. Kathleen is a colleague of mine. I should give full disclosure, so thank you for that. So FPL is federal poverty level. So it's an income of, it's a measure of household income. I believe that 100% federal poverty level for a family of 4 in San Mateo County, I believe is 19,000. Am I wrong? Somebody might know this better than I do. Maybe that's for a family of 3, around 19,000. It's very, very low. It's a federal standard and it's not adjusted locally, unlike other income security measures, and so it's kind of a global, so if you think, 200% federal poverty level is the same in San Mateo County as it might be in rural Kansas, while the cost of living presumably is less in rural Kansas, and so it's not really the best measure when it comes to specific communities, but it is what most public programs are based on. So if you think of particular subsidy programs around different services, they use that global measure. And so really what this graph is showing you is just, I picked out 4 health measures. I could do this for 400 health measures. We have the data for many, many different health measures, but I picked 4 here, and I tried to pick 4 that I thought kind of showed a diversity of health issues, right? So obesity and diabetes we've talked about, but depression and mental health isn't something that I mentioned, but certainly a health concern. But then also just self-reported fair, poor health. If you ask people on a scale of 1 to 5, how do you rate your health? And 1 and 2 were fair, poor, fair, and then it went to like good, very good, and excellent. This is people who said their health wasn't very good. And what you see for all of these measures is that people who have less income, right, the lower the income, the worse health that they have, right? So this is why affordable housing is a tool for community security and individual family security. So if we look at another measure for health, which is how long you live, which is kind of the ultimate measure, we see the exact same pattern exists. So what this is for the Bay Area. It measures going up your life expectancy, so how long you can expect to live, right? Most of us want to be at the top of that, presuming we're still in good health and can get around, right? And measures across the bottom, from left to right, how much poverty exists by neighborhood group, essentially, right? By neighborhood, the density of poverty. And so what you see is, as you have more and more poverty in a neighborhood, you have lower and lower life expectancy. And so again, where you live and health are very, very strongly related, and affordable housing is a tool or an opportunity to disrupt that. So, from my perspective, some of the things that I think are most critical to think about when we consider affordable housing that helps maximize the health of communities. And I told you I had more to ask of you than I probably had to offer in terms of what health could do for affordable housing. These are the things that I would ask you to really think about. And I am hopeful that in your discussion groups you will talk about this further and will come up with some of your own ideas. But critical, as we talked about in the beginning, is the idea of bringing housing and jobs closer together. And there has to be, those have to be strongly related. You can't have the low income, the low paying jobs and the really expensive housing in one place, right? And the really cheap housing in another place, or the affordable housing in another place, right? So we have to be able to match communities so that people can afford the housing in the community they live in, or they can find a job in the community that they want to live in. And again, I think housing, affordable housing, is a tool that can really make this possible. We know in San Mateo County that we are one of the oldest counties in the state, and we are one of the oldest states in the nation. So what that tells me is we are one of the oldest counties in the nation. We expect to have a 72% increase in our older adult population by the year 2030. And we expect to have a 148% increase in the population over the age of 85. The vast majority of these people will not be able to drive. So, how do you stay in the community that you love, where your friends and maybe your family are, if you can't drive, and you are not near to the things that you need, such as a pharmacy, a grocery store? You need to be able to walk. And so sadly, right now, we do not have a lot of senior housing, and we do not have a lot of affordable senior housing that is in an environment that will allow those older adults to walk. So we actually did a survey of current baby boomers, right? So when we're talking about the folks who will be older adults in the year 2030, they're by and large baby boomers right now. It's the group that was born between 1946 and 1964. And we surveyed them and we said, well, where do you want to live when you're retired and you're older? And most of them said, I'm not getting older. But after we got over that, a lot of them said, I want to stay right here. I want to stay in my community. But I'm going to sell my house in the hills, a big house, and I'm going to move down to the corridor so that I can walk around. So I can take Caltrain into the city for some cultural events, so that I can walk to the pharmacy, the grocery store, the coffee shop, the Y, all of those places, right? And I'm glad that we have that demand, but now I think we have an opportunity to try and meet that demand, because the sad truth is that the vast majority of those baby boomers aren't going to find anywhere to live when they want to sell that house and move to the corridor. And if we wait until they're ready, we won't have time to build all that housing. So I think there's a real opportunity for us to start to prepare for the older adult population. Interestingly, I'll add this because I heard particular interest in talking about older adults, we also asked those same baby boomers, well, if you stay where you are now and you can't drive, how are you going to get around? And overwhelmingly, about 70 to 80% of them said, I'm going to take the bus. And then when you ask them, we said, okay, well, bus sounds good, that's a good plan. And then when you ask them, well, how many of you have taken the bus today? How many of you already take the bus? And only 2% of them had ever been on a bus. So I also think we have some work to make sure that the public transportation is there, but also to get our baby boomers comfortable with the bus, so that when they're older, they'll actually be able to take that bus, right? So a lot of opportunities related to this population. That we need to think about affordable housing as it relates to health as an opportunity for building family resources and building wealth. And I wanted to share a study that's famous in the health world, but might not be as familiar to you. A prominent researcher, I don't remember his name, he's that prominent, but a prominent researcher did a big study where he took a random group of people and he gave them the flu vaccine. Yeah, it was a cold actually. He gave them the common cold vaccine, a little eyedropper, and just put it in their nose. how you can give someone the cold if you wanted to. And he sent them away, and then he had to come back to see who got the cold and who didn't. And what he found was the best predictor of the people who did not get the cold, the people who had the most protective factors, who were the healthiest, the best predictor was their parents owned the house they grew up in. They had a certain amount of security and wealth, and that had a direct relationship to their health in adulthood. So we know that affordable housing could be is a fantastic tool for building that security and wealth. It's also an opportunity for reducing family stress and increasing stability. This is really related to the previous point, but the stress of having to leave your community for affordable housing, the stress of having to drive far, all of those factors can be somewhat alleviated through well-placed and abundant affordable housing. And finally, the global opportunity is that we can locate people in healthy environments. And that has everything to do from the walkability to the air quality to the healthy food that is near where people live, to the schools that are good for their children, and all of those other factors. So I don't want to just leave you with this long list of asks, but I also want to provide you with some resources. So I've left copies of these documents on the back. You can also get all of them at this website. But the health system is in the business of putting out policy recommendations and tools that make it easier for our decision makers and our community members to build healthy environments. So these are a few of the tools that we have, and I encourage you to look at them if you're interested in the topic, download them, share them with your elected officials or other leaders, and certainly contact us if we can be of assistance to you in implementing some of these recommendations. So with that, thank you for your time, and I'm more than happy to answer any questions.
I think those are good, but I think kind of along the line of the developer incentives, I think even the density and height limits, I think that would be an incentive for developers. If they had greater height limits that they could go to, I think they would be more willing to have affordable housing units.
Okay.
Or the parking, I like the parking requirements as well.
You have to have both, so you think G and H are kind of combined?
I think, yeah, I agree.
Yeah.
Yeah.
The big problem we have, unfortunately, it's the one downside of not being a dictatorship, is that we have to depend on convincing private developers to build and make it worth their while to do it. And most, well, I won't say most, but many of the private developers I've run into are not all in it for the money. They actually do developing because they enjoy doing it. They would love to do affordable housing if they could make it work, but they have to everybody else does. They can't. And that's where incentives or something to make some money of it and still do good.
The last is Healthy Communities Forum. We had to talk about how can we make our communities walkable, like specifically, and more comfortable. And one of the strategies, or one of the factors, was topography. Well, like hills. Well, we're not going to, take a bulldozer and flatten out all the cities. That's not a very strategic step. So we're going to go through these lists of different factors that affect public health.
Is a great avenue, or joining the Full Cities team and Sierra Club, things like that. And there are also the discussion groups that are created specifically for our forums, which are taking place. Right now, we have one in San Jose, one in San Mateo, and then there's going to be another. There's going to be one starting in South San Francisco, and all of the dates of these groups are available, and you can sign up for whichever one is closest to you if you want to check them out in the back. And those groups actually specifically use this guide. They go through what the issues are listed in here, and you can see there's a new section we added for this event on affordable housing, and they talk about some of these issues. On another page, if you go to the back, there's a list of upcoming planning projects, which you can find some in the area that you live in or in your city, that you can find ways to get involved with by contacting that staff and finding out when the upcoming meetings are for people to give public comment, things like that. So those are all wonderful avenues. We also have the next Healthy Community Forum scheduled for June 18th, and it's on access to healthy food. And there are flyers in the back for that. So if you can make it out, I think it's going to be somewhere in Santa Clara County.
San Mateo County.
Oh, San Mateo.
Probably Redwood City.
Okay, so probably Redwood City. So keep an eye out for that. You can go to healthycommunitiesforums.org to find out the details in the future. And then just out of this form, all of these notes and resources are going to be typed up into a nice report that you can find on that website. So if you haven't left your email with us, you can do so in the back again, and then we will send out that report to everybody who's participated. So you can refer back to these things and you're like, what was that cool idea I heard of that we had in our discussion group? I don't even remember. So you can see exactly what those notes were. Yeah, so there are many ways to continue the discussion. We thank you for showing up, for sharing your time with us, and we hope that you continue to share these ideas and to engage your community in the ways that you do in your life.